Hi there, Dr. Matthew Korn, 65 Plus Center for Active Aging, here with your 1-minute clinic. Today we're going to be talking about something called Quervain's tenosynovitis. That's a mouthful, I know. But basically, that condition is one that involves the wrist and hand. On the thumb side of your hand, you have two tendons that essentially move your thumb. One moves it up. The other one moves it kind of backwards toward the back of your hand. The tenosynovitis affects the tendon that brings the thumb out to the side, kind of like if you were opening your hand to shake someone's hand. So the thumb would go in this direction. And you have a sheath that covers that tendon, and it can get inflamed. It can happen from a fall, arthritis of the thumb or some of the bones in the wrist. But oftentimes it's just an overuse injury, and it doesn't have to be something fanciful. It could be, opening up a jar or cracking a nut or using a hammer. And then, of course, once it gets inflamed, what happens is pretty much you use your hand all day long and it gets irritated. So believe it or not, generally splinting in rest and ice and ibuprofen or some type of non-steroidal anti-inflammatory works really, really well. I find in my clinic most people just don't adhere to that. However, there are some things we can do here in the clinic to make it feel better. Mobilizing the bones of the wrist and hand. Doing what's called tendon gliding, which is an exercise that helps you to get that sheath moving again a little bit. And you can also use non-steroidal treatments, introducing medications through a Ferreter machine or even a class 4 laser, which has been very successful at treating that condition. But again, I think that it's mostly manageable with good old-fashioned rest and ice and immobilization. But therapists can at least help you diagnose it, and maybe if you're struggling to get it better, it's been a while, you might have to involve a physical therapist, because once you get kind of past that acute or subacute stage, 6, 8, 10 weeks into the problem, you're going to need a little bit of help to get that thing to heal. One thing you can do if you have this problem is, we talked about the tendon gliding. You can take your thumb, put it into your palm of your hand, close your four fingers on there, stabilize your hand above the wrist, and slowly move that wrist in a downward and upward direction, kind of like if you were using a hammer. But you got to move slowly. You don't want to move past pain. And to be honest with you, that's not something I would encourage you to do right off the bat, maybe 10 days after the injury. So the Quervain's tenosynovitis, you can look it up online, or visit my website or my YouTube channels, learn a little bit more about it. And of course, if you have a problem, come on in. We'll take a look, see if we can't help you. Dr. Matthew Korn, 65 Plus Center for Active Aging, here with your 1-minute clinic, and I thank you for watching.